General practice is continuing its journey to be more effective and modern. And as part of that is its digital journey, whether it's as a practice, as a network, and sometimes even from a clinician's perspective. But it'd be nice if there was a guide to help you understand how to understand where you're at and where you're going in terms of the digital journey for your practice. Well, in this episode, we're joined by some of our amazing colleagues from Redmore Health as they basically lead us through what is effectively the NHS Digital Journey Planner, a document guide, whole website. Basically, it's an entire environment that's going to help you understand where your practice needs to be, where it could go, and hopefully where it will go in the future in the digital journey within the NHS. So let's tech enhance your primary care and learning. Hello, everybody, and welcome to this session where we're talking about the NHS Digital Journey Planner. I'm amazing to have our colleagues here from Redmore Health. We've got Lisa and Richard. Lisa, do you want to kick us off by introducing yourself?
Hi everybody, thanks Gandhi, delighted to be with you this afternoon, and hello to everyone. Thank you for taking time out of your incredibly busy worlds right now. I've also got my colleague Richard Stoddart here with me from Redmore Health. Richard's going to be managing some of the comments in the chat, and then we're going to pause in a little while. So just my role at Redmore Health is Director of Quality Services and Improvement, and I also still work in general practice as a digital advisor. In fact, I'm in general practice this afternoon. I've just been chatting with Gandhi, telling him how I've completely disrupted one GP setup for the afternoon. So I'll have to get all his kit back into normal before we start. Okay, are we ready to fire? So today, I'm really excited to finally share the story of the Digital Journey Planner with you. Then I'm going to show you how the system works. This has been a long project for us at Redmore Health. We started this in July 2020, but you will obviously realise that we've had the pandemic, the pressures, the vaccine programmes, so the release of the Journey Planner has been stalled a couple of times just so that we don't overwhelm the practices with any more information. And someone recently commented to us that sometimes you have to take one step back before you can take 2 steps forward. So I'm going to show you how we can perhaps help you with this journey. I like this slide. It's worth reflecting just how far we've come in the last couple of years. So this image represents a lot of what we're dealing with in digital at the moment. Those of us who have been around for a while, the GMS contracts have been promoting online services and various digital solutions since around 2015. But the pandemic has escalated both the need for digital and the adoption. So on the bottom of the graph, you can see there, you may be familiar with the tech adoption curve. Tech usually takes around 17 years to embed from the innovators first come up with an idea right through until the laggards eventually adopt what's going on. But we've crammed all of that into about the last 18 months. And on the top of this graph, you can see, I'm sure some of you will have had similar feelings about the tech that we've been given. We've had some solutions procured for us, and there's some confusion in practices at the moment about the difference between online consulting and online services. We're now seeing some practices move on from their first online consultation system, as some CCGs are re-procuring at the moment. And some practices have really experienced that trough of disillusionment. We all got excited with these new products. We realised that some of them were a little bit clunky, and we need to work with you as organisations to try and find out how your organisation or practice is. So this is the challenge for most practices and PCNs. Sorry, my slides seem to be jumping on. Do beg your pardon. So you should be back on how mature is your organisation there. We usually ask these questions when we're supporting practice, and we realised that there was no mechanism out there. They're just whizzing along. Bear with me, folks. There we go. There's no mechanism out there, no one single system that can share knowledge, share good practice, that's easily accessible and would help PCNs to plan. Can you still see how mature is your organisation slide there, Gandhi?
Yeah, we can.
Sorry about that, folks. I don't know why it's just moving on.
There we go. We're on how mature is your organisation?
Thank you. So when we ask these questions of practices, we don't know how digitally mature they are. We also know that commissioners and digital first teams have got pots of money, and they're very keen to make sure they support practices, allocate those resources to those practices who need that additional support, and also work with those digital stars to find out how well they've done it so they can share that and cascade that with others. There's masses of data sets available to commissioners at the moment, such as online management information system, OC and VC dashboards, electronic prescribing, etc. But there's nothing that builds all of this into one system. So we had to build something that would meet the needs of commissioners, but something that would meet the needs of practices and PCNs as they were developing. This slide gives you just a kind of representation of the difference between the quantitative data and the qualitative questioning and development and experience that we do at Redmore Health when we're working with practices and PCNs. So we built the Digital Maturity Index, which sits alongside the Digital Journey Planner specifically for commissioning organisations from all of the open source data that are out there at the moment, and to make them try and see what their landscape looks like. And this image here just represents one area in London. We have aggregated all of those different data sets together. There's about 14 different indicators, and you can see quickly at a glance, borough by borough, where the average is in terms of digital maturity, where those PCNs are advanced, and where some of those other PCNs need additional support. So just coming on to the PCNs here, and I'm going to apologise if you've seen some of these slides already. We used them with the NHS E&I launch last week. We also know that practices have very different experiences and patients therefore have a different experience. There's lots and lots of variation. Out on the fast lane, you've got some supersized practices there who have harnessed the opportunity of digital solutions, and they've perhaps created single teams to deliver elements of the work, such as online consultation hubs, access centres to manage call handling, etc. Most of us are in the middle lane, and in terms of progress, it's crammed right now with everything else that we need to do. But unfortunately, there are still some practices in the slow lane, or even worse, they're in the hard shoulder at the moment. And that's just making there's so much information out there. It's all impacting on access and patient experience at a local population. So what we hope the Journey Planner will do will reduce some of that variation. Within a practice, you've got variation again between practice teams, and this can be in terms of knowledge, confidence and competence. If you've only started in general practice in the last 2 years, you could be forgiven for thinking that online consultation is the only method of online delivery. However, over the last 5 years, most practices have been delivering online appointment booking, processing ordering for repeat meds, or messaging patients through various apps. Some people in staff feel like they're offering a poorer service if it's not face-to-face. Some haven't realised the benefits, and that's both in terms of workload and workflow management, and that results in access issues for patients. And then, of course, there's so many competing priorities, it can be hard to know where to start. So digital can drop down the agenda if we're not careful. So let's talk about the Journey Planner now. We've created the Journey Planner to help support practices to reduce that variation. We use a 3-step process called baseline, learn and improve. Baseline assessments will allow practice teams to answer a set of questions to establish where they are now. The learn element offers hints and tips and signposts to best practice guidance available. We know that we don't have time in general practice to trawl the internet for case studies, so we've included those within the Journey Planner. But we've also added in some handy hints and tips and some time-saving calculators for those of you who may need to persuade others of the benefits. And then the final element is improve. So we've built it as a web tool. We've done it this way rather than a spreadsheet because it's easy for everybody to complete online, and each staff member will log in with their own account. There's no worries about version control or different spreadsheets floating around email systems then. Access is via a web browser and user accounts, so there's no need to be on the NHS network system. And assessments are all linked to your practice ODS, so there's one assessment for each practice for all of the team to work on together. So although the DJP is not mandatory, some commissioners are hoping that this will inform their digital priorities. If you work in an area with us where your commissioners have purchased the enhanced access service, it may be that they request your practices to use this tool to support their planning. And I'll talk a little bit more about the different access levels in a moment. Let's talk about what it is. So it's there, as I said, lots of assessments for you to complete, but short, snappy session assessments. We've purposely kept each assessment short, Probably each module will be completed within half an hour. And as each member of the team contributes to the assessment, the others will see the same hints and tips along with their colleagues' responses. So more importantly, what it is not. We were absolutely desperate for this not to be a performance management system. We want practice teams to feel like they can be honest here, and there are no subjective statements in there or scoring systems within the journey planner. The value that you will get out of this system largely depends on how many of your team use the journey planner. So these are the modules. You'll have seen this graphic before. These modules may change depending on the priorities that the Digital First Primary Care team want to prioritise. Patient communication module is available now and will be released in GP Online via patient-facing services ready in June. The other modules will be released quarterly so as not to overwhelm practices. And the idea is that you move from left to right to embed those digital solutions. So here's a little bit more detail about the assessments that are contained within each module. And as I said, these will be released over the next 12 months. So if we showed you this way that would help you plan your journey, that could reduce some pressure and save you some time, would you come with us? As I mentioned earlier, we've got 2 levels of access. Foundation access is available nationally to all practices now, and I'll post a link up in a moment for you to be able to create your own account. Within the last week, we've had almost 300 new accounts created by 200 practices. If you're working with us at Redmore Health in an area that's commissioned the enhanced access service, you get all of this on top. This is available on subscription. The lowest level of organisational structure we've got is a PCN, but actually we've got most of this is commissioned for us by the CCGs, and I'm going to show you the live dashboards and how they work in a reporting system in a moment. Just as part of that enhanced access, you get this additional level of support from our Redmore team, so we can help you build digital champions, support your change managers, work with your PCNs, usually around a theme that's been agreed by the Commissioner or the PCN clinical directors, and then we'll work with your teams to try and embed that change and support those digital champions with additional knowledge. So just one testimonial here. This one came from a practice in Salford. We've been testing this all over the country. At the moment, we're working in areas of London, the northeast, and northeastern Yorkshire at the moment. But if you want to get in touch with us and have that conversation about that enhanced access, these are our contact details here. Contact us hello@redmorehealth.co.uk, and one of our team will get back in touch with you. So I'll just pause there on these slides before I go into the live demo. Are there any questions that I need to pick up from the chat, Richard or Gandhi?
So I've got a couple of questions, if I may.
Yep.
Looking at that, as you mentioned, GPs and practices are ridiculously busy at the moment. We're all coming off the COVID vaccinations. We're all gearing up for whatever QOF and the PCN DES is going to be throwing it our way in the next couple of months. How long will it take me to get started with doing this? Because I appreciate, as a practice, we haven't signed up to this yet. I know I need to. It's on my list of billion jobs to. Did you catch that, Lisa?
I didn't. Sorry, your audio just went off for me there. I heard you say you were going to sign up.
How long will it take me to onboard with the digital journey planner? Is probably the clearest way for me to ask it.
Okay, so all you do, I'm going to show you the live system now. I'm going to walk you through how to create your account, what to do next. Once you've done that, we've got the first module, patient communications, has got 4 sections in it. Short introductory one, take you 5 minutes. So let me just share with you what that looks like at the moment. Okay, so bear with me while I open the live system. So you should be able to see the journey planner now in the Chrome browser. Yeah?
There we go.
Can you see that? Lovely. Okay, so the link is you just type in Digital Journey Planner, and I'll post all of this afterwards. You will find this home page here. To create your account, go right down to the bottom. There's a little narrative at the top and click the Create My Account here. Okay, the first thing it's going to ask you for is your ODS code. Once you pop that in and click Continue, the next thing it will ask you for is your name and your email address, and that will allow you to create your account. Now, I'm not going to do that at the moment because I've already got an account. I'm going to just click into my account here, and you can see it remembers your password, and away you go. The first page here, the home page, gives you the available modules and what's coming next. If I click on patient communication here, what you will see, these green boxes that say completed, that's because our team have already completed that, but you will see on there an estimate of time for each module, so somewhere between 7 and 10 minutes for each assessment, okay? As a manager, I can see that all of these people here within my team have already contributed to this assessment. So I guess my plea to you as partners, clinical directors, practice managers is let go. Let your team create their own accounts. Let them work through this digital journey planner together. You sit back and then you wait and you see what their responses are, because that's where the learning experience will happen. That's when they will start to have conversations together. I've asked a colleague this morning, have you completed your account? The answer was yes, but I don't do those bits of the journey planner. So then that enables me to say, okay, who does that? Let's get them to create an account together, and then you'll see their answer. And that's where that knowledge transfer happens within a practice. So if I just run through this particular introduction, each of the assessments has got a description telling you why it's important to do something, and we hit people straight away with the benefits because we know we've got to hook people in to understand why they should do this. So these benefits will be just not within the practice, but for patients as well. And then you'll also see that we follow a very simple standard, like much of the gov.uk and the NHS Service Design Manual standard, in terms of accessibility and ease of use for people within the practice. So simple yes, no answers, depending on whether you know or you're not sure. This practice here, are they publishing the friends and family test? No. Have they actually sat down and thought about best methods of communication for each purpose? You know, we've seen some practices really adopt messaging as a central way of working with their patients, but they've maybe not told the patients to expect more than just an appointment reminder. And we've popped some hints and tips in here to sit down as a practice, work out what's the best method of communication, what needs to be broadcasted to all, what would be the best mode of delivery, etc., etc. So you just work your way through. Here's another simple question. Are we actually gathering everybody's mobile numbers? I see lots of practices with fairly low levels of mobile numbers in their clinical system. They've still not realised that it's a significant piece of information. And if you think outside of health, everybody we come into contact with, first thing they ask you, can I just update your contact details? So again, some little hints and tips about encouraging the rest of your staff. So you get to the bottom and you can either skip or you can finish. I'll finish here. I'll just show you the website one. Let's have a little look at the website assessment. We've just walk you through the navigation here. You can see down this right-hand side the different elements of the website assessment. So we've popped in there essential requirements. That will be your GDPR, your WCAG, your web content, accessibility guidance, and also your GMS requirements will be in that essential requirements session as well. And then we've popped some information in about good practice, because we know if you've got at least 10 of the things we've got in the journey planner on your website, that will reduce the amount of enquiries and footfall into the practice and makes the patient's journey an awful lot easier. So that's just a quick whiz through the website. And again, I'm going to go back now and show you on the journey planner where you pick up your implementation plan. So once you've completed all of your assessments here, you skip down to the bottom, you get your bespoke implementation plan. So all of this is available in the foundation access system at the moment, free of charge to all practices. If we click in here, what you get is your implementation plan based on the responses that you gave as a practice to those assessments. So let's have a look at the implementation plan for websites. We wanted this to be a reinforcing motivational tool. So one of the things you can do is teach people what they're doing well. It's useful for everybody to be able to refer back to, particularly when they've got complaints coming through, or they want to discuss with their PPG how they're doing, or if they have a CQC inspection, etc., etc. So all the things that you're doing well will sit at the top of the implementation plan. Then there is areas for improvement. So this particular assessment, the practice hadn't actually sat down and worked out the communication needs, and we've popped some additional resources in there to help. Again, beauty of the journey planner is if I click to this, it just opens in another tab and goes straight to that document. So we've included in here a lot of the resources that are on the NHS Futures platform and some good practice. And you can see you don't need to come out of the journey planner and then go off and search on the internet for that. It's all within the journey planner. And then we've got some further fields down here about things you're doing well, things you could improve. Let's have a look here. Again, lots of practices are missing this out as an opportunity at the moment. The NHS Service Finder and the local directory of services are super things to have on your website and to have with your frontline staff. Lots of practices we're working with weren't aware of these as service options. So that's the live system as it stands now. So again, I'll stop sharing, just see if there's any further questions, then I'm just going to show you the PCN module, if that's okay.
No further questions at the moment, Lisa, no.
Okay. So let's have a little look at the PCN.
If you're talking about it from a PCN perspective, Lisa, if you were talking from a PCN perspective, you said that obviously this has been commissioned in some areas by CCG in particular. If a PCN, and there may be some places interested in looking at this, what kind of process are they looking at? And can you give us an idea of the cost, particularly for the enhanced portion, if they wanted to explore that for their network?
Yeah, so we've priced it at 10 pence per patient per annum. So with that, you will get access to our Redmore support staff. You will get those 4 modules released within the year, but then those topic-based webinars or workshops, depending on the priorities of the PCN. We're working with the PCN in Southeast region at the moment. They really want to focus in on consistency of their messaging platform. So using their messaging platform, same templates, everybody's communicating aligned with their patients, and also using their social media as a PCN. So not running separate accounts, but using a PCN account. So giving them knowledge around, the benefits of social media, but also the pitfalls, the things that they need to look out for to do it safely. So that's at a PCN level. We've got other areas where we're delivering this on a CCG, and they're now all going through the website assessment together. We've had some practices now say, well, why do I do this on my own? Why as a PCN have we got 5 pages that all describe our extended access service slightly differently when actually it's one service as a PCN, and we should have one page that we all point to. So we've now got examples of PCNs moving to a new supplier together with one platform and reduce the number of administrators and content management that goes on behalf of that PCN. So that's where you get the time saving element, and that's where you get your consistency of experience for patients. So
absolutely. I guess if there's particularly service provision in your area that works with that, that can be really effective if you've got similar services that you're all sharing through the same routes and stuff via social media platforms, websites, etc. and things. And as you say, time saving, which is always important.
Yeah. So if you think that the work of the PCNs, we've got lots of additional roles in there. There are some practices who've not yet engaged with their population to describe what those additional roles do. The unintended consequences of that is sometimes patients get a message from part of the extended team and they don't know who they are, so they ignore the message. They've not been introduced to the fact that it might be a pharmacist who's doing a clinical review with them around their long-term condition. It's things like that you can definitely do on a PCN footprint, as well as I say, using your communications, your website, social media, your messaging, all in a synced way. So you're broadcasting to a wider population. Lots of patients don't think to look at GP websites as the first place for information. They might go to Google, but then don't necessarily go to their GP website for information. We've seen some huge improvements in GP websites in the last 12 months. Shall I show you what the PCN one looks like now? Yeah.
Shall I bring the video on for you?
Yeah, I think actually I'm going to just share my screen if that's okay, and then I can play the video and just pause it as I go. Just bear with me. seem to have lost you. There we go. Okay. Thank you. So I just recorded this because obviously this is the live system, and within the live system we've got staff emails, so we needed to make sure that we could protect some of that. So the dashboard, before I played the video, we've got it set up in a number of areas so that wherever you are within the NHS organisation system, and for those of you who are keen to tell me that CCGs will be disappearing from July, we've obviously got this mapped into the new ICBs and the ICSs, etc. We've got this dashboard, so you can search on module, you can search on PCN, you can search on CCG, you can search on users, so I can see at a glance how many users there are on the Journey Planner system at the moment. But if you're doing this on behalf of a PCN, or you're doing this on a CCG footprint, you can see the users within your area. So I'll just give you a quick run through. Obviously, select the dashboard and then select log into the system. And if we have a look at the users here, I'll just have a quick whiz down. You can see at the moment, we've just under 300 on the system at the moment. So that you can see that at the bottom. We'll have a count in here at some point. Most practices, just a couple of connections, but there are some areas where we've got PCN digital champions who are working on behalf of practices. So they're connected to all of the practices. They can see all of the assessments of the practices within their PCN, and they can pull together that implementation plan. So let's just have a little look at the reporting structure. So again, I can search on a CCG here. This, we're going to have a look at North and Central London, where we've been working. This is where we've done most of the testing. And you can see there, these are all the practices in North and Central London, how many assessments they've all completed and who's working on which assessment. If we want to look now at a practice level, we can see how many users there are within each practice. So this is useful for your PCNs. This is one in Doncaster that we're working with at the moment. We can see these are the practices within that PCN. You can see one or two users in each practice, but then within the practice, you can see who those users are, how it connects up to the CCG, and you can also see their progress on their assessments. So that's kind of a nod to the purchasers to be able to say, you know, they want to ensure that they've got value for money out of this tool. They want to know that the practices are using this tool. This is how they can see that information. But I guess the thing that's most important is that the actual detail isn't visible to everybody, and those assessments, as I said earlier, we want people to be honest. If they tick something as no because they know they're not doing it, we don't want there to be any unintended consequences of that. We want them to be able to say, no, we're not doing it now. We know it needs to go in our improvement plan. We'll come back at this in 3-6 months' time when we are doing these things, and we'll redo this assessment again. Okay, that is the Digital Journey Planner. So I suppose you want me to post in the chat how to access the Journey Planner.
So I've already put the website up for you, digitaljourneyplanner.co.uk, and anyone can click into that, into the comments and stuff, and we'll pin it on to the YouTube version as well. And if you're listening on the podcast, you'll be able to listen to it from there. I guess additional questions I had for you, Lisa, then. So one of the common things that people focus on is things like health inequalities, and particularly in some areas where the digital engagement with patients can be very different. Some populations are really good digital, some populations are really less good, shall we say. How many additional, can you give us a rough idea of the support that people will get from using this tool in terms of using their digital interaction with their patients? Because I guess that's the key focus for this, isn't it? It's about having better interaction with patients as well as with the practice, then functioning and stuff.
Absolutely. This is all around digital service delivery. So what we do know from the practices and staff that we've worked with, if staff feel confident and are competent, they're much more likely to promote digital services to patients. That's thing one. Thing two, there are lots of patients out there who are considered digitally excluded, but they're not. They just don't know about things. So a beautiful example of this is the NHS app and the functionality within the NHS app. I was on a call the other day and I heard a GP say, I didn't realise that you can see your referral information if you've been referred to secondary care, and that patients can actually change their appointments within the NHS app. So I sometimes go into a room and I'll say, okay, everybody in this room, Who deals with answering queries about test results and letters to and from hospital? Everybody puts their hand up, okay? How many of you are enabling patients to have access to their test results? A few hands go down, okay? How many of you got the NHS app? A few more hands go down, okay? How many of you knew that your patient could see their referral in the NHS app because you've enabled that for them? But even better, they can reappoint, and they can do that on their own without needing to come to you in practice. So the journey planner gives that kind of knowledge, and then what we need to do is use, as I say, those other methods to communicate out with patients about this rapidly changing environment, about things that you can do. So that cohort of patients who were initially digitally excluded are actually much less. And the ones that are truly digitally excluded for all of the other societal factors, they can be managed differently. So if staff feel confident, they will then share the benefits of this. You will see that group lessen. And then you need to work with things like digital champions in the community, working with voluntary faith sectors, various, community-based organisations to upskill them. So, we've got some programs where we've worked with libraries in the past to increase the knowledge of the library workers around things like the NHS app, really simple things. Then they can translate that knowledge out into the community. You've got to do the two things together. You've got to encourage staff to do this first, and then raise the expectation of patients at the same time, so that patients aren't frustrated because staff aren't delivering, and staff aren't frustrated because patients aren't engaging, and the journey planner facilitates some of that.
And I guess one of the things I can see with this, although it's not a benchmarking tool, it gives you a place of where you are and a place of where you can move towards. And I guess in particular, you mentioned it earlier, things like CQC assessments, which are starting up again. This is clearly some work that will show progression. And I would imagine that if you've started this process, it'll be a big, massive tick in that whole element of CQC development and all that kind of stuff for practices. So maybe a really quick and easy way to try and help practices tackle what is likely to be obviously our new CQC inspections moving forward.
Absolutely. And so one of our colleagues at Redmore, that's one of her areas of interest, is helping practices to get through the CQC inspection. What we're thinking of doing is tagging some of these questions, so it's very clear to staff that by answering this question here, that's something that will be contributing to your CQC close. But that will be in future iterations. And I think the other, coming back to the module element, was there are two key things that we're thinking of at the moment: digital inclusion and the net zero agenda are two things that really should be on everybody's radar, but they're not yet business as usual. So the debate we've been having is, are they significantly important to warrant their own module within the journey planner? Potentially. At this point, yes, with the view that we move it to business as usual over the next few years. But there's more than enough information to go in a module on its own around digital inclusion. We will probably build that. But that's what we need to discuss with NHS and I in terms of prioritisation.
Look at the digital journey planner. Aside from going to the website, what would it be?
Just missed the beginning of your question there, sorry.
So if you had a quick tip for anybody that wants to start using the digital journey planner, apart from going to the website and registering, what would that tip be?
Okay, you cannot break this. So log in, create your account, go through it, see how easy it is. If you find it difficult, get in touch. But all of our experience so far, and looking at the analytics, people that have created their account have gone straight through into one of the assessment. They haven't dropped off and they haven't bounced off. At the moment, we've got something like 90% of users having created an account move straight onto the first assessments. That's really, encouraging for us. And let other members of your team do this. We can all learn together. There is no need for a manager to seek permission from their partners to do this first. There's nothing in there that they're going to be sharing with anybody outside of the practice. So there's no consequences of working in this way. And one of the feedback we had from an early practice manager was, I now feel much more comfortable around patient communications. I can let my team do this work now. I don't need to control this anymore. And that, to my, music to my ears, obviously, because we need to reduce the pressure on managers wherever we can.
So definitely hearing that as a way of understanding where your journey is from a practice perspective, understanding where you can go, but also sharing the workload more effectively within your team, both to help the team as a whole, but also communication with patients.
Yeah,
Would you say that's a
yeah.
good summary?
Absolutely. It's learning together. It's sharing that knowledge across the team. It's working out who does which job, but not making any assumptions that people are all working to the same level of knowledge. We had somebody ask the other day, oh, can you add these questions? Can you add those questions? And we were quite firm and said, no, we want to make this an easy tool for people to use, and we don't want to overwhelm people. So it's got to be short, snappy assessments where people can do in a short space of time, get a little bit of extra knowledge and think, right, okay, we need to do something about that. And that's the process that the Journey Planner facilitates.
Absolutely. So if you do want to have a look at that, as Lisa mentioned, go to the website. So that's digitaljourneyplanner.co.uk. All of you can see that's probably on the screen at the bottom right now. Or if you listen on the podcast, as I said, it's digitaljourneyplanner.co.uk. Have a look at that. Register. Do see what it's like. I know I'm going to be doing that when I finish this because we've got a bit of time before I start clinic, so I can probably get cracking at least with those first modules and stuff. And hopefully we'll be able to see continued elements of development for practices in terms of their journey within this whole digital landscape as we continue to try and modernize and lead modernization of the healthcare service in tech and stuff. Thank you for joining me, Lisa and Richard. Hope you found the stream useful to everybody that's been watching and stuff. And if you do have any further questions, stick it down in the chat. We'll come back to them a bit later on and answer those for you. And as always, we're here to help tech enhance your primary care and learning. And we'll catch you in the next episode. See you later.
Thanks, Gandhi. Catch up soon.